Okay, good afternoon. Today we have our workshop, and at this point I'm expecting Maria. The role is changing completely because I'm asking for people who really is going to attend the activity for not staying too much time without anyone. This is under the knowledge of the academic supervisor, so it's not a new rule. So I'm correcting the role, I'm changing it completely as I was telling you. In that way, I'm going to share the official role in a minute. So be patient with this. And on the other hand, the ones who didn't attend, who decide not to get into, well, they know that it's under the responsibility. So patience. Patience. Today, we have to be so clear that stuff changing a lot. Well, there is no problem for me. So I'll be back as soon as my first student gets into. Hi, Maria. Good afternoon.
Hello, teacher.
Hi, can you hear me clearly?
Yes, teacher. I'm sorry. I confused for the hour.
No, don't worry about it. There is no trouble on this.
Okay. This time or this hour is for the next Wednesday? No. Okay, sorry. Thursday?
For Tuesday. Well, I'm going to talk to the academic supervisor because at this point is less than the half of the group that is getting into the workshop. I think we can move it to a better schedule.
Okay.
Just for this time, I'm asking I'm asking to confirm who's going to attend or not. And according to that, we are going to correct lots of things.
Okay, teacher. That's okay.
Okay, perfect. So let me see. Questions from yesterday, maybe? A detail to check in.
Only one question on the vaccine. Vaccine, I don't say what is the pronounce. Vaccines? Vaccines?
Vaccines.
Vaccines.
Yes, about the vaccine.
Vaccines.
Can you watch my screen, right?
Yeah, one minute. I see that. Okay, I see you.
I mean,
screen.
this word, right?
I have difficult to pronounce the vaccine. I don't know say immunization.
Yes, it happens. It's vaccines.
Vaccines.
Yes, like using an X instead of double C. Vaccines.
Okay, vaccines. Okay, it is. I don't know say what is the from acquire. I don't know. I need help. Donde se protect them from acquiring. Again, teacher. Sorry.
Don't worry. Acquiring.
Acquiring.
Acquiring serious.
Acquiring. Okay. Acquiring serious. Okay. Yeah, it's most better.
Don't worry about it. That's the point of this, to improve this kind of details.
Yes. It's difficult words. I need to practice. But it's in the same question for the travels. The vaccines, travels is a correct expression or travel vaccines? Vaccines.
Again, I didn't catch the meaning. Can you repeat, please?
Okay. What is the correct, how do you say the correct, is travel vaccines or vaccines travel?
No, the traveler vaccines.
The travelers vaccines.
Yeah.
Okay.
So let's see.
I ready.
You can say vaccines for travelers like this, or travelers vaccines. It's common way to say travelers vaccines.
Okay. I don't say the hospitals, or maybe where is on the apply? No.
Yes.
Administrate the apply. Administrate the vaccines for the vaccines for travel.
Yes, vaccines for travel. This chart is just a list, the general list, which vaccines are going to ask in a huge way, a huge place, I mean. But you're asking for the part of the body to apply or to administrate the vaccine, with the per oral or intramuscular.
Bueno, yes, but the principal is the place. In the hospital, or is and buy in the pharmacy when
yes,
¿cómo se dice? When common, no, I don't know, antibiotic.
Okay, it's according to the place. according to the country, I mean. For example, here in Bolivia, our healthcare system has specific consultories in the primary care service to go and receive the vaccines, not for everywhere. And moreover, you can buy some vaccines in the drugstore and then go to make them applied in very specific private centers, not everywhere.
Okay, but I think the vaccines for, bueno, specific vaccines, I need a complement, a paper, I don't know, a form.
Yes, you need a form. In general words, you need a form and sometimes the ticket of your flight that is supporting where are you going and why do you need that kind of vaccine, because they are not so common, right?
Yes, but it's no common vaccines.
Yes, for example, for catching the meningococcal vaccine, you have to go with your flight ticket, and then you can buy the vaccine and get it applied. But you have to support that you are going to that place because of all the complications they could bring to you. We have to be clear on this. But it's according to every country, it changes. In Cuba, for example, you had one specific day for going with your flight ticket and the medical prescription to ask for the vaccine. And if there was available, then you could receive that.
Okay.
In Europe in general, you have to go to do you remember in the 8th class, I think, we were talking about a specific consultory room when there was a doctor for giving recipes or for giving prescriptions to patients. That's the place where you go to pick up the order for your vaccine when you have to go to another place.
Okay, this is, okay, I got it now.
Yes, it varies from one place to another.
Depending on the country, maybe?
Yes. According to the country and the healthcare system, they can give you the vaccine by free because it's a national program, or you have to buy it.
Okay, I never traveled for outside of Mexico.
Okay.
I don't have idea where is the place apply the vaccines, aplicar.
Yes, in Mexico, if my memory is not failing because of the friends I got there, you have to go to the public healthcare system with your flight ticket, and then ask for the specific date to receive the specific vaccine you need.
Okay.
It's supported by the government. It's not for selling.
Yes, but in USA, I think it's a sell the vaccine.
Yes, in USA, some vaccines are for selling, some of them are by free. It depends on the one you really need. For example, anti-malarial vaccine is by free. Everywhere I went is by free. No cost on this. You don't have to pay it. Anti-tuberculosis vaccine is by free too. Anti-polio, again, is by free. COVID-19, according to the place and the lab, could be by free or you can buy it. But, well, because it's new, right? It's under study at this point.
It's a new vaccine. Okay, teacher. That's all.
Okay, everything is that clear now, right?
Yes, teacher.
So from this slide, do you have any question maybe about vocabulary?
Yes, teacher. The pronunciation, no. But no, that's okay.
Okay, there was another chart I was asking for. Did you have the chance to read these blue charts, these blue boxes with?
No, I really not read this one. I read today.
Okay, no, don't worry. Try to read this because the vocabulary is very important from this because they are supporting these ideas and showing you lots of details about it. About this, did you have the chance to read this one? Because I know it's a lot of vocabulary at this point.
Yes, that's this slide. No.
Yeah.
This slide I review before and receive the message.
Okay. So don't worry. If there's any questions, send me a message, and according to that, we can solve the doubt. Okay.
Okay, teacher.
Okay, perfect. So, any other detail to check?
No.
So we can say well, at this point, everything is clear. So, okay, let me send you the pool to take attendance. Okay.
Teacher, thank you.
Okay, can you watch the pool?
Yes.
Perfect. Okay, thank you. I received that. Let's close this. Okay,
Sorry, the
perfect.
train is pasado. Un moment.
Okay, don't worry. So, Maria, tonight I'm gonna send the homework file from the slides of this week and the answer of the previous homework, because I realized now that I didn't send the answer.
Okay.
So you're going to receive both files, okay?
Okay, teacher.
Okay. So, moreover, I'm gonna send a file, an extra file with some guidelines to read, to check, for start writing again. Okay, and according to that, we can fix doubts on the
It's
next.
the same instruction for the homework.
Yes, I'm gonna send the answers from homework 1, the file about homework 2, and an extra file with the guidelines, with instructions about how to write down the physical exam. Start checking
Okay.
details. It's gonna be easier for everybody to get on practice, get in touch on this. And on Tuesday, we have the chance to work on that during the workshop, okay?
Okay, teacher.
I'm gonna talk to the academic supervisor for receiving or for changing the schedule, but I'm gonna try to make it in a better schedule for you, specifically for not being so late or not being so early. That could be a mess with your job, okay?
Okay, teacher, it's good for me.
Okay, I'm gonna try to extend this time for you specifically, okay? You could be the first one. It's gonna be easier.
Okay, teacher, thank you.
Thanks to you, Maria. So don't worry and keep on reading, okay?
Yes.
Okay, my dear. So see you Monday, okay? Have a great weekend.
See you. Thank you. Ay, ¿cómo era good? I don't remember what you say. Igualmente.
Okay, you can say same for you, or you can say, just say the same, and that's enough.
Okay, same for you. Thank you.
Thank you.
See you.
Okay, so see you Monday. Bye-bye, dear.
Bye-bye.
Okay, let me show you the new role for tonight. Just okay, it's here. This is the new role. Neil sent me a message. He has no way to get into today, but he wants to stay at the same hour. At least he told me something. Then Maria was here, but we changed a little bit the schedule because that was possible. And then in 7 minutes, Julian is gonna attend. At 7:15, I really need this time to check how my babies are going on, so it's not going to be any student there. But at 7:30, I'm gonna continue until finishing with the rest of the people. At this point, I didn't receive any message asking for being the last one instead of Natalie. But patience, let's wait. Let's wait. So that's all. I think that's all. As I told you, These changes are under the knowledge of the academic supervisor, so there is no trouble in this. So I'll be back in 5 minutes. Hi, Juliana. Wow, you have a big word in
I
your
know.
back.
Yes, I don't know how to.
Hi, how are
I
you?
did
How
that.
was your day?
I am tired. And your day?
Well, it was a very busy day. With 3 babies, it's not easy. I'm running mad.
Huh.
But patience at this point. I got a great babysitter and they are happy
Mm,
with her, so it's better. Better for me.
mm, I'm happy for you.
Yes, I really need her help. And she's so nice. So let me see, Juliana, do you have any question, details to check again from yesterday?
Mm, yes, but I don't remember in what slide is.
Okay, let's look for this. There is no trouble. How is that going on? Can you tell me the question?
I don't remember because I don't have the slide.
You didn't download them yesterday?
I thought I upload, but there is no. It's not in my cell phone.
Mm. Okay, I'm gonna send it to you by WhatsApp. Okay,
Okay, Miss.
yes, sometimes it happens by the Zoom chat. When you try to download it, it's not possible to make it. As soon as you
Okay.
get it, in order I get the attendance, it's possible to solve the situation.
Okay, Miss. Thank you.
So let me send it to you. Don't worry. And do you remember a detail how the question was going on?
The next one, let me think, is like the 4 or 5 slide. I don't know.
You tell me where to stop.
Okay. Next one. Okay. There. Those things, when I have to use that, for
The rate.
example, the rate and all the things.
Okay, when we talk about the statistics in epidemiology,
Okay.
we are converting the subjective information, I mean, diseases, diagnosis, everything in numbers, right? We are making that exchange. When we make that exchange, we need to study that numbers, and according to that numbers, we prepare rates, scales, we prepare charts, we prepare pie charts, we prepare these formulas in order to understand how our population is changing, how many people is dying, how many people are on birth, how many people are survivals about specific situations. But we need numbers to make it possible to make objective in job and then support how we are working on. That's why when we talk about rate, we consider a period of time and a circumstance or many situations that can be compared through the time. Okay?
Okay.
That's why in this example, I'm showing you a period of time, right? Many years, and the rate, the ages, how these situations are changing through the time. And we can compare, for example, the heart disease is this line, how they are almost in the same level in comparison with the HIV infection, the rise up gradually, right?
Yeah.
Yes, in that way, rates are helping you to make possible to catch this information in a value, converting it to objective data, and making it possible to study and use formulas to develop job in a better way.
Okay.
And lots of mathematics, I think, but
Yeah.
they are necessary for understanding how our population is changing. Okay.
Yeah. The slide after this about the vaccines.
Okay. This one.
Yes.
Okay. In this chart, I'm showing you just some examples about a few vaccines that are very common in South Asia.
For example, in the in slide this. For
This
example,
one.
in North America, it says anti-influenza.
Yes. Anti-influenza
That's the
virus vaccine.
that's the vaccine that is required in that country.
Yes, just in that
Or
country.
for example, I am from South America, so if I want to go from North America, I have to have anti-influenza or anti-yellow fever, malaria.
It's according to the country you are living. Okay, for example, if I am as a Bolivian want to go to USA, I need the anti-influenza virus vaccine, the COVID vaccine, but not the Chinese, yeah, the Russian could be, the Sputnik. Then I need the anti-malarian vaccine according to the city you are arriving.
I am. Okay.
Why the anti-malarian? Because in Bolivia, we are endemic with yellow fever, with malaria.
Okay.
If you are from an endemic place, you need
Mhm.
the anti-vaccine from that endemic situation. If you're not from an endemic place, but you have the chance to go for visiting just, there is no trouble. You don't need the vaccine, the specific one. When I was living in Cuba, just for being from La Paz specifically, I need the anti-malarian vaccine and the anti-yellow fever vaccine because in the place I live, both of them are situations that are very common, we can say. We have rates, we have charts showing that how patients getting contagious with these infectious diseases. But, well, because I'm from I'm from the city, they don't understand that in the city there are no common situations, but they told me that I need them. So, patience.
I get it.
Yes. Okay.
I need that.
You are from
I need
Ecuador,
the
right?
vaccines.
Do
Yes,
you
I'm
have
from Ecuador.
malaria and yellow fever there too, I think?
Yes.
In that way, they are going to ask for these vaccines. The anti-yellow fever, I think, is the commonest one.
Yes. Yellow fever. Malaria? No. We don't have malaria. The ministry don't give us as well. That vaccine. It's just yellow fever.
Okay, yellow fever, yes, it's a yellow ID showing that where the year you received that, year and month you received the vaccine. Some IDs with the yellow fever vaccine ask for showing the level of the vaccine in the ID, and that's all. That's why according to the place you go, they ask you. But as a general view, they are the common vaccines for travelers that are required. This chart is previous to the COVID-19 pandemic. But
yes, COVID is like anti-influenza. I think it's required in everyone.
No, it's different. It's different. With anti-influenza, you are thinking about that kind of specific virus, the influenza virus. The COVID-19 is a different one. My baby came to visit us. I don't know how, but she's here. That's my name with my baby sister, yeah?
She wants to teach.
Yes, he wants to play with my computer. She loves typing. Okay, she's going away.
Oh,
Don't worry about it. She has to understand it's not possible to stay here.
okay. Mm,
So, any
I-
other details to check? Maybe, Juliana?
I don't think so. Well,
Okay.
I don't. No, I think I don't have any other question.
Okay. In order you then get the slides, give me a minute to send them to you. I'm gonna look for them.
Yes, miss.
And that way, let me show you the pool now.
Okay.
Please fill this one to take attendance, okay? And
Okay,
I'm
miss.
gonna upload the presentation for you, the slides for you, because you really need this material for reading, for studying.
Yes. Okay, miss is on the attendance.
Okay, perfect. Thank you so much. Now, I send it to your WhatsApp. Please check if you get the slides and if it's possible to open them, okay?
Yes. Yes,
Okay.
I can watch.
Okay, perfect. Open the file. Is that everything okay with that?
Yes, it's everything. Okay. Yes, miss.
Okay. Great. Check the information again. And if there are more questions, please let me
Thank you,
know via
miss.
message by WhatsApp, okay?
Okay, miss. Thank you.
Okay, Juliana.
Have a
Any
good
other
night.
detail to let me ask you something. Is that okay, this is scheduled for you? Because talking to the academic supervisor, I had too many spaces in the previous workshops. That's why today we were asking for the ones who were attending the workshop. If this schedule is okay for you, we can stay at this time.
Yes, it's okay for me.
Okay, perfect. So I'm gonna support that this schedule is gonna be yours now. Okay?
Okay, miss. Thank you. Yeah, it's okay for me.
Yeah, perfect.
Okay, miss. Bye. Have a
Okay,
good night.
bye. Thank you. See you Monday. Bye-bye.
See you Monday.
Okay, there was Juliana. Now I have 15 minutes to check what is going on with my babies, why they were walking. So patience, I'll be back in some minutes. Pamela, well, let's wait. She might get back. Hi, Pamela. Can you hear me?
Hi, sorry, I just get out.
Yes, I said, well, it happens, yeah. Patience. Don't worry, it happens. Let me see, how was your day? Everything okay?
Yes, everything okay.
Perfect.
And yours?
Well, a busy day with 3 babies is harder,
Yeah.
harder than it should be. But it's possible to make it.
Yes.
Okay, do you have any question from yesterday? Something you would like to check again?
I was reading as the hour was of my work. I don't know.
Okay.
Of this was of this class is earlier than the normal hour I used to have. I
Yeah.
just arrived to my house and I just read the half of of the presentation.
Not
I
worry about
didn't.
it. Not worry. I know that this change is a surprise for everybody, but I really need to work with the people who want to stay, because there is no way to expect people that is not attending.
Yes, I understand, but I try to read the most I can, but I didn't finish. I read till the medical ethics
Yeah.
from that I didn't read anything. But
No.
yesterday class was, I think I understood everything. And of the first part, I really don't have any question.
Okay, so it was a clear class, so
Yes,
okay.
it was. I think it is an easy topic because I don't know. In my university, they talk about all these the pillar of medical ethics in everything. So I think
Yes. Yes, when you analyze the medical ethics and the 4 pillars, how to apply them, or how we, by accident, we break them, we realize that it's not as easy as it looks, right?
Yes, when you have a complicated situation, in our exams, the university used to put difficult cases. So I think when you read, is everything like obvious, but when you have to apply, I think sometimes is a little bit difficult.
Yeah, that's true. When you get in touch by practicing, you run mad because you don't have enough time to think about it. Sometimes we act by instinct, in the way I expect things should be. But there is the moment when we certainly make a huge mistake. And well, through the time we can understand and learn that we need to take a deep breath after taking a decision, right?
Yes.
Okay. So about these definitions on epidemiology, there's no trouble, right?
No.
They're very general.
It's and you said yesterday that common we can say that it's just used to compare.
Yes.
Or we can use where here it says not that you don't have to say, but
Just making
the
comparisons.
incidence of malaria is common.
Yeah. when you compare two groups of people or two situations, you can use common that, common than, more common than, less common than. It's very common. It's the same rule, the same grammar rule than social English, of course. Only remember that this is just for making comparisons, not for reading rates or scores.
I can't say that malaria is common in my country because I don't know. I thought it was okay.
Yes, as a sentence, that's great. It's common in my country. It's common in South America. Malaria and yellow fever.
Yes.
It's more common in South America than in USA. Yeah.
Then I guess.
Yeah, yes, could be. That's a good way to start. So
Okay.
keep on reading the slides. If there's any question, any detail to talk about, you can send me a message by WhatsApp.
Okay.
That we can solve the doubts, okay?
Thank you. So I will finish reading. But I think yesterday class
Was so clear, I think.
clear. Yes.
Yes, in
But
these
I will.
charts, don't forget reading these examples. Because of the vocabulary you can achieve from this, you can reach many ways to understand. And that's a good example how to deal with the pillars in medical ethics.
Okay. I will pay attention to that.
Yeah, is that they are interesting situations during the history of medicine. You can find lots of situations where we as doctors didn't follow or didn't respect the medical ethics through the history, we can say through the time. And we only developed experiments, we can say, developed research without taking in account the opinion of the population, of the people, right?
Yes.
It's different from now, that now you have to ask for the informed consent. And according to that, receiving that signature, it's possible to start study, but it's controversial.
You see, I think it's okay to ask people to give their opinion, their
Their
to
permission.
say their permission. But for example, in my hospital, I tried to publish a report case, and the hospital gave us a lot of conditions to publish. The patient who was involved, he signed, but the hospital makes wants a lot of papers and for letting us just sending the report to a scientific
Yes, the committee, the scientific committee.
Yes, they ask a lot of things, and I just saw all the things we have to send, just for letting us to publish that. I didn't want to that lot of things, and the patient just say yes, but the I don't know, the hospital makes us a lot of problem to publish. But
yeah, that's true. to ask for, well, when you have the chance to be a participant on a research, you learn that the process is not as easy as sometimes we think. As you say, lots of questions to make, lots of information to collect, and then the permission for publishing the results. It's a lot of job, right?
Yes.
And that's a good point for your hospital to ask for these permissions and everything previous to making the research. That's a good point of view. In Cuba, for example, you never had the chance to ask for that kind of permissions.
Why?
Well, because it's communism. That's the way they work. If they wanted to make research, for example, when I was a student, they were proving that the pulmonary maturation in fetus was the best way to avoid the use of, in prematures, the best way to avoid the use of the incubadora. Yeah, I don't remember how to say it. But without asking mothers on risk, I mean, they just go and they were applying the medication, telling them that this was for the baby and there is no right to say anything. So you get into the research, like or not. If there are complications that of course could be, it's a risk that the government is going to take, but you don't have any right to say yes or no. It's different. That's the way in communism.
Yes. I think it's terrible. Don't be asked for putting a medication if you don't want.
Yes, no. If you don't want, you don't have any right. You have to accept it. You cannot deny. If you need a surgical procedure, you cannot say that you are not, you don't want it. You have to accept it. There is no way to avoid it. You don't have the pillar of autonomy in that kind of regimen, that kind of living. I didn't like it. Or, for example, if you had a terminal disease like cancer in the last days, you know you are going to die. It's a rule in Cuba that you have to die into the hospital with that kind of situation. You cannot go home and stay with your relatives. You have to stay there alone. And it's so sad, I think. It's not correct.
Yes.
And that's another reason for not living there. I don't recommend that.
Yes, I didn't know that the medicine was like that.
Yes. In order, everything is by free. You don't pay anything in Cuba. And you don't anything. You don't pay nothing. You don't have the right to choose what to do or how to go ahead, or when to take your relative at home for giving them comfort. It's not possible to do that. You have to stand, you have to continue. And the first time I saw this and I realized how things were going on, I ran mad. I said that it was not possible, no way to live in that situation. But that was, a professor told me that was the regimen and I have to stand it if I want to reach my title. If you want to continue, don't say anything, continue, try to do your best, try to help in the way that the regimen is not finding your actions. And according to that, it's possible to make it.
Oh my God. I don't know if I could. I think like being there, and if my title depends on that, I think I don't know. I would accept, but it would be very difficult.
Yeah, I'm here to give me a second, please. Okay, I'm back. My baby came here. my newborn.
Mm.
She's starving. I don't know,
Wow.
always when we are talking, my baby is start making too much noise. It says, there's Pamela, yes, yes.
Hi. Mm. It's okay.
Thank you for your patience.
Mm.
Really,
Yeah,
I
don't
really
worry.
appreciate that because it's not easy with kids. That's a
Hmm.
difficult point while talking from home. Okay,
But don't worry.
okay, so let me send you the pool to take attendance, okay?
Okay, thank you.
Okay, can you watch the pool?
Yes. And it's done.
Okay, perfect. Thank you so much.
Thank you.
Okay, so tonight I'm gonna send the homework file of this week, taking into account the slides and the answers of the first homework file. I realized I didn't send it. So
Yes.
you're going to receive both of them in the WhatsApp group, okay?
Okay, thank you.
Okay, so follow the guidelines, follow the deadline. And according to that, we are going to continue next week.
Okay.
Okay,
So,
Pamela.
see you
So,
on Monday.
okay, this schedule is okay for you, or do you prefer to come later?
I think if you can put me the later, the last one, because here is 1 hour earlier, so it's very early to me for having. But
Okay.
just if you can.
Okay, I'm gonna correct it, and according to that, we can get in contact to check the best schedule for you. Okay, Pamela?
Okay. Thank
Okay,
you.
perfect. Okay, see you Monday.
See you on Monday. Bye.
Bye-bye. Hi, Carla.
Hi, teacher.
How are you? How was your day?
Fine, thank you, teacher. It was okay.
Great. Well, a busy day with 3 babies. But
Oh,
we can go
yeah.
ahead. We have to continue.
Okay.
Okay, so let me see. We are changing schedules, and now I'm reorganizing the group about the workshop because
Yes,
I need to
I.
know. Well, I need to work with people who wants to stay there because, well, I know sometimes it's not possible to make it because of job or something extra.
Yes.
So let me see. This schedule is okay for you?
Yes, teacher, it's okay.
Okay, perfect. I'm asking for everybody in order to reorganize everything again.
Good. Don't worry, teacher. It's okay for me.
Perfect. So we are going to stay at this schedule with you from this point until the end, okay?
Okay, teacher.
Okay, let me see. Do you have any questions, something you would like to talk about from the presentation of yesterday?
Yes, teacher. I was checking I was just checking and trying to search for the meaning of fully vaccinated traveler because it wasn't clear for me if it's about the doses or all the vaccine that a traveler must have.
No, it's about the doses. For example, with COVID, you have the chance to receive with, I don't know, the Sputnik, 2 doses, right? Or Johnson & Johnson, 2 doses.
Yes.
If you receive the 2 doses, you are fully vaccinated with that vaccine. And you don't need to receive more.
Okay.
Okay, it's specific by every vaccine. And for example, anti-yellow fever vaccine, you need 1 dose every 10 years. right?
Yes.
If you receive the first one and 10 years later you receive again the second doses, you are fully vaccinated. There is no trouble.
Okay, so it doesn't matter how long it has been the last dose, right?
It depends on the vaccine. For example, hepatitis B,
Yes.
you need to get vaccinated at the month, 3 months, and 6 months, and I don't remember the last one. You need 3 or 4 doses, right?
Yes.
For telling that you're fully vaccinated about hepatitis B, you need all the doses, the 5 doses actually.
Okay. And for example, if there's one vaccine that's just one dose, like for tuberculosis, that term doesn't, we don't use that term.
No, you don't really need that because you receive that vaccine when you are a newborn, right? You don't have to check, you have to show the scar you get in the left or right arm.
Yes.
And that's enough. That scar is the proof you received the vaccine.
But for the vaccines that just need one dose.
No, that's the truth. You're fully vaccinated with that. In that case, there is no trouble on this.
Okay.
For example, when you go to places where tuberculosis is under control, they don't ask you for an ID or for a paper showing that you received the vaccine when you were a baby. They just check if you have the scar or not. Right?
Okay. Yes.
That's enough. When I was in Cuba, when you arrive at the airport at the first time, they check the scar. If you have the scar, you can get into. If you don't have the scar, you have to go to quarantine period for the studies and check that you don't have tuberculosis at the moment, if there is not an active situation.
Interesting. I didn't know that.
It's very interesting how the epidemiology works there because it's so effective.
Yes.
When we get the influenza situation, we can say in 2008 and 2009, when you arrived to Cuba, only by making a sneeze and a chew in the airport, you were under quarantine 15 days. It was terrible because I left La Paz, I was with a flu. And when I arrived to Cuba, I was with fever. And they were running mad because they told me, you have influenza, you don't have to move from here. And I was under quarantine 15 days alone. It was terrible. Who knows the place I was? I was completely alone. I remember that just they bring me the food, water, and no further anything to my door. They knock the door and run away. And I said, okay, thank you. Who you are? Hello, I'm here. I'm still alive. Yeah. There is no fever. That was funny.
Wow. For you.
Yes. Horrible experience, that 15 days.
Yes. Must be.
But that's the way they work. In Cuba, for example, tuberculosis is a controlled situation because their politics in the following treatment and all the control they need to give, to make the diagnosis is guided by the epidemiologist. I mean, the epidemiologist goes to your house, takes you by hand and brings you to the lab to take the studies.
Wow.
The one who's giving the treatment, they don't expect for you to go to the medical consult. The doctor or the nurse goes to your house and ensures that you are taking the pills.
Wow. So effective.
Yes, it's the same with when you get HIV as a positive case.
Yes.
They go to your house and ensure that you are following the diet, you are following the control. Well, that's the way that communism works. But it's so effective to make the case control. I mean, to ensure that the treatment is taken because it's money that the government is paying for you. It's not correct to avoid that opportunity, right?
Right, like here, the patient
Yeah.
doesn't go to it.
Yes, patients avoid it. They say, no, there are too many pills. They are cheating me. I don't need them. And they don't take it. And we're wasting money.
Right, and then they die.
Yeah. They say, no, it was not for me.
Yes.
But patients, that's different.
Wow, I didn't know about that.
When you live there, when you have the chance to go and check how patients have to take it, you say,
Mhm.
oh my God, thank you for not born here.
Mm.
Following the vaccine charts in every country. In Cuba, your baby gets born and you receive the schedule of vaccines, the same as here, the ID vaccine.
Mhm.
And previously in the hospital, you receive the dates. You have to go back to the hospital to receive the vaccines to your baby. For example, today I had the BCG vaccine, but I didn't go because I forget it. Tomorrow, the doctor is coming to my house and giving my baby the vaccine. There is no
Wow.
way to lose it.
So there is no chance that you want to be an anti-vaccine.
Yes, there is no chance. You don't have the right to do that. You cannot choose if receive or not a treatment. You have to receive it because you don't pay anything. If you decide to be anti-vaccine, it's easy. In Cuba, they tell you that you are responsible with your kids and they can take out from your family.
Wow.
To a hospice, right? So you have to receive them, stay quiet, do your best, feed good the baby. That's enough.
Do your best.
Yes.
Wow.
I remember in a situation, there was a divorced family. Parents were separated, and the kid was moving from father to mother every week. And we lost one vaccine. We went with the mother's location because that was the one we had in the clinical record, in the clinical history, but the baby was not there. We went in a second chance and the baby was not there again. The third chance, the police went to look for the mother and were asking for the baby. They told her that if the baby was not there in 1 hour, she must go into prison because of negligence.
Wow.
We said, what? Why? There are just 3 days. No, that's a program we have to follow. That's organization. We don't have to lose it. The baby has to live just in one place. Doesn't have the chance to move because it's not the stability that the kid needs. Well, they have right. They were clear on that. When the baby was there in the hour that the police was asking for, we applied the vaccine and that's all. But the police was over the mother asking for why the baby was moving so well with the father and here without permission. Yes, if you want to change your house, your location, you have to ask for a permission to the government. It's not by free like here. You can move by your own, but all the documentation is with a location. If you're not in that location when government needs you, it could be a trouble.
You can go to the jail.
Yes, it's according to the situation. You could. If there is a kid in the trouble like this situation with the vaccine, you can go to jail for negligence. You are obligated to follow and to complete that programs. It has positive aspects because you have the chance to get very well immunization, yeah. a well-controlled population. But certainly it's not very free. You cannot choose. If there is a side effect, for example,
Yes.
well, you have to go to the doctor and cross fingers. There's no way. Because you are at home receiving the
complain.
vaccine. Yes, they go with the coolers, apply the vaccine for 1 or 2 kids, and then go back. If there is a side effect at home, well, you have to run to the hospital at the moment. Sometimes we waste time, right?
Yes.
Wow. It's a different organization, just.
Mm. Yeah. Yeah, I can imagine.
No. First time is hard to say that. But when you get used to this, it's different when you come back and try to realize that the reality is different. And there is actually no problem. You have to have the chance to decide about yourself, to follow the pillar of autonomy is an advantage in some cases and a disadvantage in some others, right?
Yes.
It's different.
Yes, very different.
Okay, Carla, thanks for the poll. Your attendance is done.
Okay, thank you, teacher, for helping me with that term.
Yeah, they're the fully vaccinated. When you go to other countries, according to the place you're going, of course, you use the same IDs. They could ask about any other specific vaccines. But according to that, when you ask for the visa, they decide if you really need to be fully vaccinated or maybe just the first doses for getting into.
Okay. Okay, teacher.
Yes, it's nice.
Thank
Yeah,
you.
it's very interesting.
Yes, it is. Thank you.
Okay, tonight I'm gonna send 2 files. The first of homework. The first one with the answers of the homework 1 that I didn't send yet, and the second one with the homework from this week. Okay.
Okay, teacher.
Okay. So see you Monday. Okay, Carla.
Bye, teacher.
Okay.
Have a
Bye
good night.
bye. Hi, Diego.
Hi, teacher. How are you?
Fine, fine. How are you? How was your day?
Good, teacher. I was just finished cooking my dinner.
Oh, great. Great. So I'm interrupting
Yeah.
the dinner.
No. Don't worry, teacher. I'm waiting to be cold my food and start eating.
It's so hot at this point.
Yeah.
Okay, let's wait until it's refresh.
Okay, teacher. Okay.
Okay, let me see. Did you have the chance to check the slides?
Yes, teacher. I was checking the slides.
Yeah. Is there any question? Something to check again, maybe?
Sorry, teacher. I think.
Hello, Diego. I cannot hear you clearly.
No, sorry, teacher, because I was with my brother and he was bothering me. And he didn't know I was passing the class.
Okay. No,
Yeah,
no.
but I was how I was telling you, I could check the slides and I was thinking that it's like the all the I don't know the same thing that in the university have teach us to us, right? I think
Yes.
it's like more a part or of the laws and the procedures that we must follow
Yeah.
in all the specialties. I think.
Yeah, that's true. We have the general guidelines, we can say here in the slides, just for refreshing the concepts, the ideas that we have to talk about, right?
Yeah.
Yeah, perfect. So about expressions, about vocabulary, maybe a question?
Well, I think in this part I could get the point in the vocabulary because it's an easy translation from Spanish. I think
Yes,
as
yes, and
I was.
it's very similar to Spanish and English at this point, right?
Yes.
Words are not so complicated.
Maybe as I could ask to you, teacher, this in this aspect we it could be different. I think in other places in the area of health, right? I don't know if in a different country, the procedure maybe could be different, and in that case, well, I think the best choice could be listen to or reading to the to those laws, right?
Yeah, according to the place, according to the ganjas they could use, could be a very small difference, but not so big, because as a general idea, it's possible to catch the meaning.
Okay.
For example, what about the pillars of medicine? Well, all of them, everywhere they are the same. They are not going to change. Now, with the association and causation, it's possible to make it. Incidence and prevalence are the same everywhere. Maybe
Yeah, because of the formula. Because of the formula, yeah. Yeah.
Yes, the formulas. Well, when we go to numbers, everything gets in a universal language, right? If you prepare your formula in a correct way, your interpretation is going to be the same everywhere, no matter the language or the place you are. Maybe some expressions, for example, person-to-person contact, but it's an epidemiological concept, this one, so it's different. I never heard that it changes.
I think that one that was highlighted at the previous slide, the word outbreak, it means I don't know if a new moment, event,
A new
event,
beginning.
a new beginning.
Yeah, a new beginning of a case.
Such an outbreak of Japanese encephalitis. Okay.
Yes, in this context, it's a new beginning. It's a new moment with the Japanese encephalitis. In this case, the outbreak, and for example, in psychiatry, when you said you get an outbreak, talking about schizophrenia, is that moment when you get the diagnosis, right?
The first signs that it's showing the patient that he has schizophrenia. Yeah. Okay.
Yes, that's the outbreak of the situation, because everything changes suddenly, right?
Yeah, from that point.
Yes.
Okay. Yeah. Okay. Yeah. While you were changing the slide, teacher, I could read that word. Yeah, the other ones highlighted, I understand.
Yeah. Okay. They are possible to make so. About this, is that clear, the ideas of this, right?
About the vaccines?
Yeah.
Yeah, I think that with the PAI,
Yeah.
that we work at the country. I think in the Spanish term, I got it. So in English, it could be the same, right?
Yes. 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 They don't change. The places of applying the vaccine are always the same everywhere. About this, the screening tests. It's a small list, I know, but there are a lot of tests to develop.
In this case, it's better to refer to those screening tests as with the abbreviation or the complete extended
No,
expression.
no, that is not trouble. In English, when you have, for example, the PCA test, just for saying PCA test, you don't have to use the complete expression, because we know that this abbreviation, PCA, is not for all the tests, right? This is specific. So don't worry, as much abbreviations as you use, it could be better.
Oh, okay. So if I need to prescription a certain screening test, it's better to make the abbreviation to my
Yes,
patient, for example.
yes. It's better because the one that is gonna receive the order knows what you are talking about, because you have a space that says probable diagnosis.
Oh,
You have to
okay,
give me
teacher.
why you are sending that study. It's not by free, not because of yes. You have to follow again the protocol, and according to the protocol or the risk that the patient is showing, you have the capability to send or not that is a specific study.
Okay, teacher. Thank you. Yeah, in that word, or in that case, sorry, I
Yes.
get clear now, because I think here in the Spanish term, it's better to put all the name, is the extended name
Yeah.
of the complementary exam.
Yes. Well, in Latin America in general lines, we have the chance to do it. Always the complete name, the full name with everything. But sometimes you say, why me?
Yeah. Why I
Why?
should I
Yes, and you
I
say,
could not.
okay, patience, I have to continue. Yeah.
Yes, teacher. Okay.
So
Yeah, in that slide.
for
Mhm.
example, when you are making the diabetes screening test, the fasting blood sugar, and it's positive, it's over than 120, you ask for the hemoglobina glucosilada, right?
Yeah, the second one.
Yes, that's the second one. You don't have the
Yeah.
chance to go just to that study. At least you have a proof that you certainly need it. You are following the protocol, right? In
Yes.
English, you only send the abbreviation. That's all. You
Oh,
don't need more details on that. It's
it's
easier.
easy.
Yes,
Yeah.
it's so much easier. For example, if you need this, the TSH, only TSH, newborn, enough, or Hill test, enough. They know that they are looking for 5 diseases.
No.
Here you, well, in Latin America in general, you get all the extended terms, but it's for a loyal purpose, I think. Just the
Yes, teacher.
purpose for not getting in confusion, not getting in trouble with the patient, because patients has that trouble, we can say, when they mix the information, and we as doctors have to stand, have to support, have to be, I can say, have to be so clear and try to avoid that conflicts, that troubles, right? Well, our rights as doctors are so vulnerable, so easy to get in double interpretation. Hi, Diego.
Yes, teacher. Sorry.
No, no, don't
I think
worry.
I was answering to you.
Yeah, oops, again, you are without sound. You are without microphone. Oh, okay, again with microphone.
So, oh, sorry. I was trying to put me
Oh,
online again. I think my Wi-Fi is really bad when I'm in the kitchen. But I was saying yes, teacher. I could get the meaning or the idea that you told me that baby is easiest in other countries rather
yes.
than here in Latin America.
You have that specific space probable diagnosis, and it is supporting why you are sending this one, the test with abbreviations enough. It's better patients don't understand, don't get it a mess, don't go to the Google doctor. Don't think that everything is cancer. So it's better.
Yeah, yeah. The first thing that shows Google when you search for a pain of something.
Yes. I have headache, probable cancer, yeah. No, you said, what? What's going on? Yeah. Right.
Yes.
Okay, I think it's clear with you, everything.
Yes, teacher. Thank you so much. I'm going to check the other presentation as you told me yesterday.
Yeah.
And if I get some questions, I'm going to bother you via WhatsApp at the weekend, please.
Yes, there is no trouble. Send me as many messages you need to. There are more questions, is better.
Yeah, teacher. Thank you so much because I think that in the previous presentations I got more questions than the last theoretical class.
Okay, perfect. Keep on reading, keep on studying, and according to that, I'm gonna expect your questions, okay?
Okay, teacher. Thank you.
Okay, I send you the attendance pool.
Yeah. I think yeah. It's a little lagged, but I'm sending to you. Yeah.
Perfect, I got it. Thank you so much.
To you, teacher.
Okay, so Diego, this schedule is okay for you?
Yeah, teacher. This one is good, or the previous one that was at 8:15. The both of them are good for me, but I think a little bit better of this one.
Okay, so I was asking for everybody about this change in the schedule because I really want to work with people who's attending the workshop, right? For using the time properly. If this schedule is great for you, we are going to stay at this point without changing again, okay?
Thank you, teacher. Okay, it's good to me.
Okay, perfect. Thank you so much. So don't forget it. We are going to continue from this point and ahead until the end, okay?
Okay, teacher, I got it.
Okay, Diego, perfect. So is there any other question, something you would like to talk about?
For the moment, no, teacher. Thank you so much.
Okay,
I could
great.
get it.
Okay, perfect. So keep on reading and I'm gonna expect your questions, okay?
Okay, teacher. Surely I'm going to send to you.
Perfect. Tonight I'm gonna send 2 files. The first one with the answers from homework 1 that actually I didn't send them. And a second file with the homework of this week, okay? With new questions from this last
Okay,
2
teacher.
presentations, okay?
Okay, teacher. I'll be in touch with the notification of the work,
Perfect.
of the home.
Okay, that sounds great. So see you Monday, Diego, okay? Have a great weekend and keep on reading.
You too, teacher. Thank you so much. See
Thank
you Monday.
you. See you Monday. Thank
Bye,
you.
teacher.
Bye-bye.
Bye.
Okay, there was Diego, there was Carla. Let's wait. Natalie is gonna come in 10 minutes. She was asking for this. So I'll be back in some minutes. Hi, Natalie. Good night. Natalie, you are without microphone. Yoo-hoo. Okay. Yes, I'm here. Let's answer.
Teacher, can you hear me?
Yes, now I can hear you.
Okay.
Hi, how are you? How was your day?
Really boring. I've been sick all these weeks.
Okay, do you feel okay? You sound so strange.
Yeah, I have some headache and I got flu.
You got a headache, maybe a migraine?
Yes, that's exactly what I have.
Yes. Okay. Do you want to work in that way, or do you prefer to take a rest, to take free time?
Can we I don't know if we can work tomorrow morning?
Yes, we can work in an extra time by WhatsApp.
Yes,
There is no
please,
trouble
teacher.
for me. So let me send you the pool to take your attendance and not having a trouble with academic supervisor, okay?
Okay, thank you, teacher.
Okay, if you don't feel okay, I understand. Don't worry about it. When you feel better
Okay, yeah.
tomorrow, send me a message in the moment you have time for talking, and then we can get in contact, okay? There's no trouble for me.
Okay, teacher, in what hour can we work?
Well, actually, you are the last one, and I'm expecting the answer from one of your classmates. If he doesn't tell me anything in 15 minutes, I'm going to close the Zoom session. There's no trouble, but
Okay.
if you're with migraine, because of the light of the cell phone and, well, everything we should talk, it could be better for you
Yeah.
to take a rest and let's talk tomorrow. That's an extra time. There is no trouble for me.
Okay, teacher. Please. Thank
Okay,
you.
we are supporting that you were here and there is no trouble, okay?
Okay, teacher. Thank you.
Okay, go take a pill. Try to rest. That's the best part. And well, anything you need, you can send me a message, okay?
Okay, teacher. Good night. Bye-bye.
Bye-bye. Well, Natalie was sick. So let's wait until 8:45 for Paul for his answer. And if he's not attending, I'm gonna close this. And that's enough. That's all. So I'll be back in some minutes. Okay, everybody. Paul answered me. He's not attending. He's in a semiology class at the university. He's not getting into the workshop. So following this and following the poll that I was asking for in the afternoon, there is no one else that is getting into. So I'm going to close everything. The workshop is over. So see you Monday in the